to do fundal massage.
We had a blood pressure. That looks really weird.
No worries.
Blowing in this tube.
So, when you're looking at a uterus postpartum, you look for it to rise in the abdomen and want to make sure that that it does that when the placenta detaches. But you want to also make sure the uterus is firm after the placenta is out. So what I'm doing now is feeling to make sure the placenta is firm and low, and this placenta is displaced and high. And so what you want to do is put strong pressure downwards against the uterus to kind of encourage it to contract. Sometimes taking both hands to massage it can help. If that doesn't help, if it's not firming up, you would want to do bimanual pressure, placing a hand in the vagina and then pushing the uterus down against that internal hand and then kind of rocking it there to make sure that it firms up. And usually you'll feel it getting nice and firm and small and hard. And then you also want to be watching the bleeding and making sure that the bleeding should decrease. That's a really important tool to tell whether what you're doing is effective.
So how would you do that with your hand in the vagina?
It'll come out.
You just
Usually, yeah, there's room for the blood to come out. What I have almost never done a bimanual massage. It's almost always a fundal. And then, but if I'm concerned that I'm not seeing, I'll put downward pressure on the lower edge of the vagina to create space for any clots to be expressed, any blood to come out.
okay.
So you think it's important to, whenever you're doing the bimanual compression, to take your hand out every 10 seconds,
No, I wouldn't feel like my hand would impede the blood flow if there's a real hemorrhage. Like I'm not that concerned. I would really be paying attention to the uterus, but even if the uterus is firm, then I would take my hand out and observe the blood and make sure that she's not still hemorrhaging. Because if she's still bleeding profusely, then I would want to think about other things, which is probably beyond the purview of your project.
Okay. So what does profuse bleeding look like? Is it like pouring out?
It can be like a river of blood. So it can be a gush. Sometimes it doesn't always have to be a constant gush. It can be like
Pulsing?
A trickle that becomes more every now and then. It can be normal because the uterus doesn't contract all the time. It's normal for it to loosen a little bit and then contract in kind of waves, the way that it does during labor.
Right.
So there might be some kind of rhythmic gushes, but I don't usually see that postpartum actually. And it's hard. I mean, what you would want to do if you're concerned about bleeding is you would want to make sure there's a fresh pad so that you can see if there's any.
You can accurately measure.
Yeah, exactly. Yeah, and that's what I was thinking it might be too much for you guys, but it might be worth thinking about whether you could incorporate teaching tools about volume and blood and that sort of stuff in terms of blood loss.
We actually went to a Fundal massage training
a
session.
postpartum hemorrhage.
It's like popular going around.
And you go around, you see you estimate how much blood will last and stuff.
So you could, incorporate something like that to show them, because with that taught all of us is we underestimate all
everybody
the blood loss that we have, and now I think I overestimate everything because of that class.
But it's fine. If you overestimate, it's fine.
Yeah, it's true.
So my comments on this is I feel that when the uterus is boggy, it's maybe a little too firm.
Okay.
Usually what it feels like, it kind of feels floppy and almost liquid in a way, or like jello kind of inside the belly. And then as it firms up, I couldn't really feel that this needs to be a little larger maybe. Because I couldn't feel that it was getting firm as it deflated. And I don't know if that's if it's possible to have like a different chamber for liquid to move into. You're the engineers, but I would feel like liquid would give more of a feeling.
So when you're doing the fundal massage, you feel like there's liquid inside,
or it feels squishy in a way that the air-filled bladder didn't feel kind of squashy.
Like that bag behind you.
Like the sloshy?
That's kind of, like when it's really boggy, it really feels like mush.
Have you ever seen like one of those balls where you squeeze it and then like the goo pops out the side?
Yeah.
It's like a
yes,
stress
it feels
ball.
like that.
Is that kind of like the feel of it?
Kind of slippery under the skin and under the fat and all the integumentary stuff. But yeah, that's similar.
What is actually inside a boggy uterus? Is it just full of slosh and blood, or?
It's empty.
Sometimes
it's just
clots, but
usually it's just muscle. It's just the floppy muscle that hasn't firmed up.
So it's just empty, floppy, uncontracted muscle.
It's like it's like a deflated balloon.
Okay.
And so, and then as it firms up, it becomes firm and feels like an inflated balloon. Sort of.
Okay. Okay.
And then, yeah, my other comment would be if you want to do bimanual compression, just more space.
Okay.
But
And
I
when
think
would
maybe
you
it's all
when
the
would you
same.
do bimanual compression versus fundal massage?
I always start with fundal massage. If that's not helping, then I usually give medications. And if that's not helping, then I would do bimanual compression. I try and avoid that because there's increased risk of infection. But if I were to be practicing in places where I don't have access to medications,
Right.
if fundal massage on its own doesn't help, then I would just do it.
Yeah.
Okay.
And in cases where like people are really dying from postpartum hemorrhage, it's better to
Do it.
do
Yeah.
it.
Okay. Thank you so much.
Mhm.